Moving on to our next weight loss agent, that is naltrexone bupropion, a combination drug consisting of two active ingredients, naltrexone and bupropion. Just like phentermine topiramate, this combination medication works through a dual mechanism of action to help manage obesity. Naltrexone functions as an opioid antagonist, specifically targeting the mu-opioid receptors within the reward pathway of the central nervous system. By blocking these receptors, naltrexone modulates endorphin activity, ultimately diminishing the rewarding effects of food intake and resulting in a decreased desire to eat. Additionally, naltrexone is thought to enhance the release of POMC peptides, such as alpha-MSH, which suppresses appetite and promotes satiety. Bupropion, on the other hand, primarily affects the neurotransmitters dopamine and norepinephrine. It inhibits their reuptake, increasing their levels in the brain. This results in increased energy expenditure and reduced appetite. Bupropion also stimulates the release of POMC peptides, similar to naltrexone, further contributing to the suppression of appetite. The combination of naltrexone and bupropion creates a synergistic effect that enhances weight loss outcomes. By targeting different neurotransmitter systems and utilizing their complementary mechanisms, the combination of these two drugs allows for lower doses of each medication, reducing the risk of side effects and improving tolerability. Overall, naltrexone bupropion is a unique combination that addresses both appetite and energy balance, making it an effective option for obesity management. Next, let's discuss the mechanism of action of liraglutide and semaglutide, which are both drugs from the glucagon-like peptide-1, GLP-1 receptor agonist class. GLP-1 receptor agonists are a class of injectable medications used for weight loss and diabetes management. Liraglutide and semaglutide are synthetic analogs of human GLP-1, a naturally occurring incretin hormone secreted by the L cells of the small intestine in response to food intake. The mechanism of action of liraglutide and semaglutide involves binding to and activating GLP-1 receptors located in various tissues, such as the pancreas, gastrointestinal tract, and central nervous system. Activation of these receptors has several effects that promote weight loss and improve glucose homeostasis. First, liraglutide and semaglutide stimulate insulin secretion from pancreatic beta cells in a glucose-dependent manner, meaning that insulin is released only when blood glucose levels are elevated. This helps to prevent hypoglycemia and enhances blood glucose control. Second, these drugs suppress glucagon secretion from pancreatic alpha cells. By inhibiting glucagon release, they decrease hepatic glucose production, thereby reducing blood glucose levels. Third, liraglutide and semaglutide slow gastric emptying, which prolongs the feeling of fullness and reduces food intake. This effect contributes to weight loss by promoting satiety and decreasing overall caloric consumption. Finally, liraglutide and semaglutide have been shown to directly act on the central nervous system, specifically on the hypothalamus, where they enhance satiety signaling and reduce hunger, further contributing to weight loss. These central effects may be mediated through the activation of GLP-1 receptors in the brain, or through indirect mechanisms such as vagal afferent signaling. In summary, liraglutide and semaglutide, as GLP-1 receptor agonists, exert their weight loss effects through a combination of actions on the pancreas, gastrointestinal tract, and central nervous system. These actions lead to enhanced insulin secretion, reduced glucagon release, slowed gastric emptying, and increased satiety, ultimately contributing to decreased food intake and weight loss. Tirzepatide is our final weight loss agent to discuss. Tirzepatide is a novel drug belonging to the class of dual glucose-dependent insulinotropic polypeptide, GIP, and glucagon-like peptide-1, GLP-1 receptor agonists. This drug is unique because it targets two incretin hormones, GIP and GLP-1, which play a crucial role in glucose homeostasis and appetite regulation. The mechanism of action of tirzepatide can be divided into four primary effects. Number 1, enhanced insulin secretion. Similar to GLP-1 receptor agonists, tirzepatide stimulates glucose-dependent insulin secretion from pancreatic beta cells. This means that insulin is only released when blood glucose levels are elevated, minimizing the risk of hypoglycemia. Number 2, suppressed glucagon secretion. Tirzepatide also suppresses glucagon secretion from pancreatic alpha cells in a glucose-dependent manner, leading to decreased hepatic glucose production and contributing to lower blood glucose levels. Number 3. Delayed gastric emptying. By slowing down gastric emptying, tirzepatide prolongs the feeling of fullness after a meal, which can help reduce overall food intake and promote weight loss. Number 4. Increased satiety signaling. Tirzepatide exerts its appetite-suppressing effects by enhancing satiety signaling in the central nervous system, specifically in the hypothalamus. This results in reduced hunger sensations and decreased food intake. Overall, tirzepatide's dual agonism of both GIP and GLP-1 receptors leads to better glycemic control and weight loss by enhancing insulin secretion, suppressing glucagon secretion, delaying gastric emptying, and increasing satiety signaling. And with that, I wanted to thank you for watching, and I hope this video has been informative and helpful to you. If you have any questions or feedback, please feel free to leave them in the comments below, and don't forget to subscribe for more education.